Tusar Kanti from Kolkata. I am an MD Medicine and consultant physician. We will discuss today the understanding of hypertension and what blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the wall of blood vessels. This is called blood pressure. Normally, in healthy person, it rises and falls throughout the day, but when blood pressure remains high for a longer time and left untreated, it can cause to serious health complications. In general, persistent increase in blood pressure higher than the normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle, for example, not having enough regular physical activity, obesity, smoking, alcohol consumption, stress, and etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries get stiffened up and narrow as excess of fat builds up. Family history of high blood pressure is a known comorbidity. One or more close family members with hypertension increases person's risk of developing the hypertensive state. Excess salt intake is also known to raise blood pressure. Not eating enough foods with potassium can increase blood pressure, and the risk of stroke and chronic kidney disease increases. Eating processed and fatty foods increase fat throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to the rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious sign and symptoms. That is why it's often called a silent killer. It puts people at risk for several diseases, from cardiovascular problem to kidney failure, stroke, and even eye damages and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring of blood pressure is the only way to know whether the person is having hypertension or not. Generally, when symptoms do occur, they include morning headache or tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be below 120 by 80 millimeter mercury, or it can also read as 120 over 80 millimeter mercury. Here the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower numbers indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between the beats. If the blood pressure level is more than 140 by 90 millimeter mercury, then the person have hypertension. If person have BP level higher than this, then he or she might be at a risk of developing serious heart disease. On May 17th, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is Measure Your Blood Pressure, Control It, Live Longer. Ensure that your BP is measured and controlled if it is elevated. The risks can be prevented and reduced by taking steps toward a healthier lifestyle, such as regular exercise, healthy diet, quit smoking and alcohol intake, regular blood pressure monitoring, stress management, and very importantly, adherence to medicine. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay, or reduce the need of medication. So let's take a look at these strategies one by one. Regular exercise or physical activity. Exercise can be a drug-free approach to lowering blood pressure. Regular physical activity makes person's heart stronger. If one has a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessels will decrease and lowers the blood pressure. In other case, as we all are aware that age and weight gain are the two major risk factors for high BP. So if the blood pressure is at a desirable level, that is less than 120 by 80 millimeter mercury, then exercise can help prevent it from rising as you age. Regular exercise also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of a week. High BP level can be reduced by doing regular structured exercise such as brisk walking, jogging, or swimming. Healthy diet. Diet also plays important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and avoid alcohol consumption. DASH diet, DASH stands for dietary approach to stop hypertension diet. Eating DASH diet, that is rich in whole grains, fruits, vegetables, and low-fat dairy products, and skims on saturated fat and cholesterol, can lower one blood pressure by up to 11 millimeter of mercury if having high blood pressure. Reduce sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeter mercury if you have a high blood pressure. To decrease sodium in your diet, you can consider tips like read food labels. If possible, choose low sodium alternatives of the food and beverage you normally buy. Eat fewer processed food. Only a small amount of sodium occurs naturally in the foods. Most sodium is added during processing, so you can eat natural products, avoiding the processed food. Don't add salt. Just 1 level teaspoon of salt has 2,300 milligram of sodium. Avoid adding salt to food. Use herbs or spices to add flavor of your food. Stop smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise patients to self-monitoring of their blood pressure at home. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get a more complete picture of person's blood pressure. Reading at different times further helps us in better prediction of cardiovascular morbidity and mortality rather than a single routine blood pressure measurement occur during clinic visit. Stress management by learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure. Stress management techniques include exercise, listening to music, focusing on something calm and peaceful, and meditating. And most importantly, adherence to medicine. A medicine to lower blood pressure may be recommended by doctor if your blood pressure is consistently high, usually at or above 140/90. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.